How to treat opioid addiction. So this is a big topic, and it needs to be broken down into two main arms. The first arm would be total abstinence, and the second one would be harm reduction. I'm going to speak first about total abstinence. In the short term for total abstinence, the treatment involves getting off the drug of choice and substituting it with an opioid replacement therapy. So this includes methadone, which is a drink. It's a liquid form and needs to be taken every day, once a day. The other treatment is the newer one called Suboxone, otherwise known as buprenorphine, which is, technically speaking, it's an opioid agonist / antagonist. I don't want to get into the details of it, but it is a long-term, once-a-day dosing, and this one is a pill. And it allows the user, whether it's methadone or Suboxone, to get off their drug of choice and then to get on these new medications, and then the idea is to slowly wean them. Slow wean is for most people because going through rapid detox is a very difficult, petrifying experience. I know because I went through it myself. I went through a rapid Suboxone wean, and that was it weaned over approximately 10 days, and then that precipitated 3 days of detox. For me it worked, but I was in rehab at the time, and it's not for everybody. The long-term weans generally are the safer bet, and there's a lower incidence of relapse. So that's just the short term though for opioids under total abstinence. The long term is to get into rehab and to change my way of life, the way in which I deal with stress, how I cope in life, to get out of the isolation. These are the important, long-lasting ways of treating opioid addiction. So the other form is harm reduction, and what this means, it's sort of ambiguous what it means. But harm reduction basically says to minimize the harm that I'm causing to myself as a drug user. So there's total abstinence saying I quit completely, but some people just can't do it. They try it, but they can't help themselves. They get back on the opioids, even though they're on the opioid replacement therapies. And this is where total abstinent programs don't work, like 12-step AA, for example, or CA or NA. They don't work for these particular people. And we don't want to cast them aside and say that they're failures. We want to be able to help them to minimize at least how much damage they're doing to themselves. So the idea is to moderate how much use. If you're going to use, to try to control your intake. Also try to control the quality of the drug. So for example, with IV drug users, you want to minimize contaminated heroin, contaminated with bacteria, contaminated with things like fentanyl, to minimize damage caused because of that, both medically and physically, mentally as well, and of course to prevent overdose. That's the most important arm of harm reduction.